types of hyperpigmentation. Okay, one is sunspots. These are due to mutations in the DNA due to sun exposure, and they typically will manifest as freckles initially, but then they become sunspots when they no longer fade in the winter. So that's basically the definition of sunspots. If you're not going to pursue laser, what you want to do is apply a topical agent which works not just on diminishing abnormal pigment, but also on getting at the root of anti-aging, which is really DNA repair and UV damage reversal. Okay. A second class of hyperpigmentation, which is very problematic, is melasma. Okay, this is hormonally induced, and how you can tell the difference is it's usually like an island or a patch that's present on each of the upper cheeks, and sometimes it's on the sides of the forehead, and occasionally you can see it on the upper lip. Melasma will usually form if somebody is on or off oral contraceptives, the pill, and it typically will manifest when women are in their 20s or 30s. And then the other scenario is when people are in perimenopause, usually in their 40s. The perimenopausal form tends to be more apt to pass once people get into their 50s. On the other hand, the oral contraceptive form, or the one that happens in pregnancy or delivery, tends to be a little bit more stubborn and more severe, in my opinion, in my experience. The way I approach that form of hyperpigmentation, again, is twofold. You need to have topical therapy in place. And in the case of 37 Actives, I've included a host of anti-brown blotch ingredients, which are amino acid derived. Things like glucosamine, ergothioneine, arginine, aspartic acid, and arbutin. These are gentle. They're appropriate regardless of skin type, whether you're dark-skinned, light-skinned, they're safe to use. And they will only interfere with abnormal pigment production. They're going to leave your normal skin alone. 37 does not include hydroquinone or kojic acid. Hydroquinone is banned in Europe because excessive use has resulted in what's called ochronosis, or excessive pigment deposition, ironically, in the whites of the eyes and also on the skin. And it does not include kojic acid, which is banned in Asia.
Why is it banned in Asia?
It's similar to the hydroquinone. It has been found to cause some untoward effects, and excessive use has also caused dyspigmentation, ironically. So exactly what it's designed to treat, it results in an untoward effect, an adverse event. So those are the two banned ingredients abroad, which I chose not to put in 37 so as not to eliminate that fragment of the population, and also because there are some data suggesting, at least in the case of hydroquinone, that it may actually cause DNA mutations. There may be some carcinogenicity risk. The FDA is actually looking at this. However, if somebody has a really big problem with melasma, we can write a prescription for hydroquinone, and I always recommend that people go with a prescription product when you're dealing with a product like that that's controlled.